Hello and welcome to another emergency questions and answers for families in intensive care and intensive care at home. I want to welcome you to the live stream, and I also want to welcome you if you are watching this on replay. I hope you can hear me. Maybe just type one into the chat pad if you can hear me. We will be going for about an hour here to answer your questions. And before we go there, you may wonder, if you're new to this, what makes me qualified to answer questions for families in intensive care and with intensive care at home. Once again, my name is Patrick Hutzel. I'm a critical care nurse by background. I have been working in critical care for nearly 25 years in 3 different countries. I have worked as a nurse manager for over 5 years in intensive care, and I've been consulting and advocating for families in intensive care since 2013 here at intensivecarehotline.com. And we have saved many lives with our consulting and advocacy, and you can verify that on our testimonial section at intensivecarehotline.com, or you can verify it on our intensivecarehotline.com podcast, where we have done client interviews. I'm also the founder and managing director of Intensive Care at Home, and you can get more information at intensivecareathome.com. With Intensive Care at Home, we are currently sending intensive care nurses into the community in Australia, all around the country. We are providing a genuine alternative to a long-term stay in intensive care, predominantly for long-term ventilated adults and children with tracheostomies, adults and children with tracheostomies that are not ventilated, but also BiPAP, CPAP ventilation, home TPN, home IV potassium infusions, home IV magnesium infusions, PEG tube changes, nasogastric tube changes. We also providing an emergency department bypass service with intensive care at home. We are the only service in Australia in 2024 that has third-party accreditation for intensive care at home nursing, and we're sending hundreds of years of intensive care nursing skills combined into the community, which enables us to look after the highest acuity clients at home in Australia. Without further ado, let's look at the first question. Now, if you have any questions, type them into the chat pad, or you can join me live on the StreamYard link here. You can join me live on the StreamYard link here by clicking on the link, and you can talk to me directly. So the first question that came in actually before this, before we're making this video, is actually from Susan, and Susan wrote in after we announced that we do a YouTube live. So Susan sends a very good question. Now let me go to Susan's question. So Susan writes in, she says, "Hi Patrick, my sister just turned 61, has been in ICU for 22 days on a ventilator. In April, she had a hemorrhagic stroke, which was significant, but she came back from it with just a few mild issues. 3 weeks ago, she was rushed to ICU for seizures. She was put into an induced coma and given seizure medications. When the doctors took her out of the coma, she could not wake up. Several days went by before the doctors realized she must have had a rare reaction to the seizure medication. She must have had a rare reaction to the seizure medication, which was not allowing her to wake up. The seizure medicine." Now, before I move on with the email, all I can say here is, before the doctors tell you she must have had a rare reaction to the seizure medication, and she's not, that is why she's not waking up. Well, number of questions here right away. The first question would be, what sedatives has she been on if she was in an induced coma? That's number one. What opiates has she been on if she was in an induced coma, right? Next question, what does the MRI scan of the brain show? What does the CT scan of the brain show? What does the EEG of the brain show? Right? Those are the first questions that need to be answered here before we look at anything else. Now, Susan continues in her email. The seizure medicine was changed and she was able to open her eyes and move her legs and arms upon command, but that was all she could do. However, she is diabetic and is in constant atrial fibrillation. The atrial fibrillation actually caused the original stroke, and apparently she had a little stroke prior to that, which the MRI showed. Yeah, I'm not surprised that the AFib caused the stroke, because basically what happens with atrial fibrillation, the heartbeat is irregular, and because the heartbeat is irregular and there's a higher risk that a thrombus will develop because of the irregular heartbeat, which can fire off a thrombus causing a stroke. So if AFib is undetected and untreated and unmanaged, the risk for a stroke is so much higher. Now, for many patients in atrial fibrillation, they end up on amiodarone, digoxin, metoprolol, or they have their electrolytes corrected, such as potassium and magnesium, but also they often end up on blood thinners, such as warfarin or clexane, or any other blood thinners that will prevent the blood from clotting and therefore preventing the risk of a stroke. So then Susan continues. The doctors had trouble throughout her stay in ICU managing her blood sugar, heart rate, and blood pressure. She was on many medications. She developed pneumonia, which is not getting better, but slowly getting worse. She has been given 2 different antibiotics for the pneumonia. At one point, the doctors tried removing the ventilator, and she couldn't breathe because her throat had swollen shut due to irritation of the tube, and the doctors were not aware of the situation. Interesting. So if the throat had swollen due to irritation of the tube, one thing that the doctors can do and the nurses can do before extubation, before removal of the breathing tube, is doing a leak test. So what that means is, before you extubate and you're worried that there is swelling, right, and you're worried that if you take out the breathing tube, that the airway would shut down completely, right, which sounds to me has happened here, you can do a leak test. You take down the balloon, the cuff on the breathing tube, right, and you see whether there's a leak and whether there's enough air going through and whether the patient can breathe independently. That's how you check that. So maybe they've missed that critical step. That's what it looks like to me. Because then Susan continues. She had a cardiac arrest when her breathing stopped and lost her heartbeat for 2 minutes. They were able to resuscitate her and put in a small breathing tube. Yeah, that now makes sense. So they hadn't done the leak test. They took out the breathing tube, not knowing that the airway would block, then putting in a smaller breathing tube, potentially causing damage around her airway. That sounds like they've been they haven't been doing the right things here, right? Then they gave, and then Susan continues, then they gave her steroids to get the throat swelling down. Yes, that is standard treatment, to give steroids or adrenaline nebulizers to get the swelling down. She wasn't getting enough oxygen through the small tube and it was moving around, so they were able a few days later to put the larger tube back in. All the while, she was being sedated to keep her comfortable and from pulling out the tube. The doctors told my sister 2 children, their mother needed a breathing tube in her neck, which would allow, hopefully, for the pneumonia to heal. They also put in some port for all the medicine she was receiving. Right. So basically, Susan is referring here when she says the doctors told my sisters 2 children, their mother needed a breathing tube in her neck, which would allow, hopefully, for the pneumonia to heal. Which what that means is she's referring to a tracheostomy here. They also put in some port for all the medicine she was receiving. Okay, that's good. Now, the tracheostomy in and of itself will not heal a pneumonia, but it will make ventilation easier and it will help mobilizing a patient, which then might help to clear the pneumonia, right? So, then Susan continues. The plan was to send her to long-term health care when her oxygen levels were better. It has been 3 days since the tracheostomy has been done, and she's still not awake, although she did open her eyes once and move her feet, but has done nothing on command. The doctors now say her intestines have stopped working. My niece and nephew are in their early 30s and don't know what to do. They do not want their mum suffering, We are told she is not suffering, but also do not want her to have a poor quality of life. After the tracheostomy, her left hand has no feeling and doesn't move. After the trach, her left hand has no feeling and doesn't move. I think her left leg, and that's probably as a result of the stroke, I think her left leg is only moving from spasms, not on command, from her mind. She did have issues with her left side after the stroke, but was able to improve and could walk, go upstairs, dress and bath herself, just needed a cane sometimes when walking. We haven't been told there's any brain damage. The doctors wanted to do a CT scan to get a better look at the pneumonia and put something down the trach to look also, but her oxygen needs are too high for them to move her. Okay, yes, so what they want to do is a bronchoscopy. So when Susan says the doctors wanted to do a CT scan to get a better look at the pneumonia and put something down the trach to look also, but her oxygen needs are too high for them to move her. So that means they want to do a bronchoscopy, but the oxygen levels are too high. It would be too risky to do it. Basically, a bronchoscopy means putting a video camera into the lungs through the tracheostomy. None of the family wants my sister to suffer or live the rest of her life physically and or mentally compromised. The ICU is not pressuring us, but saying we can basically wait longer and see what happens, but they're not expecting any miracles at this point. There was a second choice, I forgot, or take her off the trach, which would most likely end her life. We cannot afford thousands of dollars to hire you, but is it possible you could give me your best advice? We were hoping if my sister cannot get well, she would pass away on her own. We were hoping if my sister cannot get well, she would pass away on her own. There is no living will, so this decision is up for her children to make. We would greatly appreciate your input in these situations. Thank you so much, from Susan. Susan, thank you so much for writing in. There's a number of issues here. So, first off, you should be talking to a neurologist here as well. Okay, you should be talking to a neurologist and find out what is their prognosis, right? Those situations are really, really tricky. And let me try and put this in perspective for you. So let's just say you end her life now and you say, let's, stop everything. Let's remove the tracheostomy. Let's just stop everything. You will never know if she would have improved or not. You will only find out over time, right? So from that perspective, I argue it's premature for you to make any decisions here. Very premature, right? Now, I'm just reading through it again. How many days now? Oh, it happened in April, but then she went back into ICU. So it has been a few months. Okay. So, but then she had the setback with pneumonia. Here's the problem with the pneumonia. For any patient in ICU, the risk of getting a pneumonia is pretty high as long as they're ventilated. It's also pretty high if you don't mobilize patients, because if you're lying in bed all day, right, your lungs will collapse inevitably, right? So that's one of the reasons your sister ended up with a pneumonia. Once again, many patients in ICU that are ventilated for too long end up with what's referred to as a ventilator-associated pneumonia. There's enough research about that out there. So the plan was to send her to long-term health care. And you're also saying, doctors now say her intestines have stopped working. Well, if her intestines have stopped working, you need to dig deeper there. What does that mean? Has she stopped absorbing her nutrition? If she stopped absorbing her nutrition, she could end up with TPN or intravenous nutrition, right? So I would want to know more information when they say her intestines have stopped working. That would also put a stop to her going to a long-term acute care facility. I presume you are in the United States, right? Now, the other thing is you're saying, she did have issues with her left side after the stroke, but was able to improve and could walk, go upstairs, dress and bath herself. We have not been told that there is any brain damage. Well, this is why you need to talk to a neurologist. And let them evaluate the MRI scan or the CT scan or the EEG. Let them do that, right? And let them look at the pneumonia and put something down the tracheostomy. Yeah, that's not an option at the moment because the oxygen consumption is too high. They wouldn't be able to do a bronchoscopy. Sometimes a bronchoscopy can clear a pneumonia because they're able to go down deeper into the lungs and suck out any mucus that you can't get otherwise. So yes, a bronchoscopy might be helpful. And if she can tolerate it, right? We were hoping if my sister cannot get well, she would pass away on her own. Well, this is one of the issues in ICU. You know, with all the technology, you can keep people alive. You know, you can keep people alive, and that often brings then those ethical dilemmas. How long can you continue? How long can you wait? You know, all of these issues, right? Now, also, you're saying you cannot hire me because you can't afford thousands of dollars. Well, I don't know whether you've looked at my prices online or we've sent you our prices. It's not thousands of dollars. You can, you know, there are options for thousands of dollars where you have access to me for 30 days, right? Where you have access to me and my team for 30 days. I think it starts at $1,999, but we also have an online membership for $97 a month where you have access to me and my team in a membership area and via email, and you can ask questions there, right? So it's not thousands of dollars. Okay, so on the one hand, it's good that she had a tracheostomy because that will buy her all the time she needs to improve. So that's a good thing, right? So you're not under pressure really, right? Make sure she gets physical therapy daily. Make sure she gets mobilized as soon as she's stable. You haven't mentioned anything that kidneys have failed. You haven't mentioned anything that liver is failing. You haven't mentioned anything that she's hemodynamically unstable. So there seem to be a lot of things that might be working in your sister's favor. And I think the other thing that's working in your sister's favor is she's only 61. It's not very old. You know, if she dies today, you know the outcome. With every day that she lives, you will give her a chance to improve. Is there suffering involved at the moment? Possibly, right? You know, the reality is that life often is suffering. And to get through a critical illness, suffering is often needed, unfortunately. So the question is, how much do you want to put her through? You know, how much is she prepared to put her through? Can you ask her? Is she at a point where you can ask her what she wants? Right? That would be the best solution here, that you can ask her what she wants, right? Also, they need to ensure that the AFib is being managed appropriately, right? So, is she on anticoagulation such as Clexane, Levinox, warfarin? Is she on heparin? Make sure the AF is taken care of. Is she on digoxin, metoprolol, amiodarone, any of that? Could the AFib potentially be corrected by having a cardioversion, right? Which sends an electric shock through the heart and more or less restarts the heart so that both chambers, the atrium and the ventricle, are beating in synchrony. That's the issue with AFib, that both chambers, the atrium and the ventricle, are not beating synchronously and in asynchrony. And that's causing the AFib, and that's causing the thrombus, the risk for a stroke. Furthermore, make sure they've got the diabetes under control, right? Make sure they've got the diabetes under control. Make sure you find out what's happening with the intestines. She cannot go without nutrition. If the intestines are causing issues, you know, if she's not digesting nutrition, maybe they need to look at changing her medication, such as giving her some metoclopramide, giving her something that helps her with absorption, right? If the intestines are what you are referring to dead, you know, that sounds horrible to me. Did she have a bowel perforation, God forbid, right? And it's also difficult and if the intestines are not working and she can no longer take enteral nutrition via the nasogastric tube, she should be having TPN. She should be getting TPN, total parenteral nutrition, also known as intravenous nutrition. Okay, so the question is, can you get her back to baseline? Right? Can you get her back to baseline? And that will only probably happen over time. Won't happen overnight by the looks of things. You know. So then, what else? You're not waiting for any miracles. No, you don't need to wait for miracles. However, look at the small incremental improvements that she can make every day. That's what I would be looking for if I was you. It sounds to me like she's already made improvements. I would look for those small incremental improvements that she can take every day. Make sure she gets physical therapy, make sure she gets good nursing care, make sure she gets out of bed, you know, make sure she can do all of that, make sure she gets nutrition, right? That is really going to be important. Make sure you do talk to a neurologist. Don't continue to fly blind, right? And get a repeat CT scan of the brain, get a repeat MRI scan of the brain. And make decisions that you don't regret in 12 months' time, in 24 months' time, right? Also, do not give consent to a PEG tube. You haven't mentioned it here, but it looks to me like you're in the US, and sooner or later they want you to go to an LTAC, right? And because they want you to go to an LTAC sooner or later, they will ask you for a PEG tube and then ask you to send it to LTAC. Do not give consent do not give consent to a PEG tube. Ryan, I can see you want to join in. I'll let you in a minute. I'll just finish off with that question here for Susan, and then you and I can talk. So I hope, Susan, that answers your question. And thank you for writing in. And now let's continue the conversation with... Hi, Ryan. Can you hear me?
Yeah. So,
Ryan, I can see your question. My mom has a tracheostomy long-term due to brainstem damage and inability to breathe on her own. Any advice? Ryan, is your mom also ventilated, or does she have a tracheostomy without a ventilator?
she has a tracheostomy without the ventilator.
Without the ventilator. Okay. How long has she had the tracheostomy for?
Since March, April, probably 2 to 3 months.
Okay. Where is your mom at the moment? Is she in hospital? Is she at home? Where is she?
She's home we have a nurse coming home to see about her.
Okay. And who's providing the care? Is it yourself or?
Yeah, well, I could say myself here.
Right. Right. Okay. Is your mom mobile? Can she get up?
No. Due to the brainstem damage really came about. Well, at least that's what the doctors told me. Is from the that she had blood clots in her lungs, right? And that apparently starved the brain for oxygen, leading to brainstem damage. That was the diagnosis initially.
Yeah.
And from that, they do whatever tests they just conduct, physical tests, and they came up that it's brainstem damage, and she more or less in a paralyzed state. She could move to some point, but on a bed. She
Right.
can't get up or anything like that. Um,
Did,
yeah, and she have some, how should I put it, the inability to breathe. She was weaned off the ventilator. Right. So right now is she just have the track without without any type of ventilator, and they say that assisting her in breathing. So I just want to know if a track alone can actually um improve your breathing or your oxygen levels in your blood. That is my
okay.
question, really. That is my thing. Because having a track, I mean, she could eat and eat. Nothing else wrong with her throat or anything like that. So
So
that
she is eating and drinking?
No. They say do not feed her because apparently, I don't know. Well, I not how to put it. I'm not too familiar with the track and how it is actually working. So they tell me that the doctors told me that I cannot feed her anything through her mouth. Right? It's only through the tube, the feeding tube, to the nose into the stomach.
Okay.
Because apparently, I don't know if the food does come out the tract through the throat, through the hole and the exit. Or the
Okay. Does she have a peg tube?
a peg tube?
How does your mom get nutrition if she can't eat and drink?
Yeah, the peg tube through the nose.
Or she's got it through the nose?
Yeah, through the nose. Yeah,
Okay.
and I
Okay.
usually pump the liquid food into the yeah.
Okay. Okay. How long ago was the original brainstem damage? How long ago?
That occurred, you could say, in April. So
April this year.
April this year, 24. Yeah,
Okay. How old is your mom?
53.
53. 53.
Yeah, she has bipolar as well. Eh?
Yeah. Okay.
Yeah.
Wow. Okay. Where, if I may ask, whereabouts are you? Are you in the US or in Canada or
Nah, I in the Caribbean. This is Trinidad.
in Trinidad?
Yeah.
Right. Okay. Okay. So, few things here. Can she swallow? Do you know if she can swallow? Have swallowing tests been done?
She could swallow water.
And you do, and she's swallowing water every day?
Yeah, we give her a little teaspoon, just that's a kind of how the mouth moist, yeah, because you might get trash if you don't keep the mouth, moist and clean.
Yeah,
So we give her, yeah.
Okay. Okay. And she's not aspirating.
No.
And she has been cleared swallowing from the hospital.
She? Excuse?
When, so when you left the hospital, they have cleared her that she can swallow.
No. They say she cannot eat anything.
Okay.
Yeah.
Okay. What tracheostomy does she have? What size tracheostomy?
I think it's the cuffed, the small, the
Okay.
one with that is the thing. I'm not too. I try my best to kind of educate myself on the track because I'm not too sure about it. They didn't how to put it. They discharge her from the hospital without giving us a proper, how I should put it, a proper review and explanation on how to care for the track and what is the purpose. They didn't give us all that. So I am like a total loss when it comes to that particular yeah.
How long has she been at home for?
A month, 2 weeks.
Month. Okay. Okay. All right. So she's got a cuff tracheostomy.
Yeah.
Do you know the size? 6, 7, 8, 9. Do you know the size?
No, I don't know the size.
Okay. Have they given you some spare tracheostomies?
No.
Right. So the only tracheostomy you have in your home is the one your mom has in her throat. You have no spare tracheostomy.
No spare.
Okay. Okay. Is there an inner cannula? Do you know what I mean by that?
No, I don't know.
Okay. Do you change? So how often do you suction her?
From mucus, probably twice.
Twice a day?
Yeah, twice, depending on how much mucus we get in. Yeah.
Okay. Okay. And when you suction her, there's no inner cannula. I'll show you what I mean. If you give me a second, I'll just get a tracheostomy and I'll show you what I mean, because I think that is important for you to understand what I'm talking about, because this could be critical. Just give me 1 second, please.
Okay, no problem.
Just give me 1 second, and then I will show you what I'm talking about. Okay, can you see that? That's a tracheostomy.
Yeah.
Right. So you've got the balloon. You've
Right.
got that. Okay. And just give me 1 second. I need to show you. So an inner cannula looks like this. It comes in and out.
In and out. No,
You
no,
don't. That's not.
no.
You don't have. It
It's
doesn't
just
have that.
open. Yeah, no.
Okay. All right. All right. Okay. That's fine. That's fine. So, um, who checks the balloon, and how often do you check it, if you check it at all?
We wasn't advised to check anything when it comes to that.
Okay.
They were just say maintain it, clean the mucus with the suction machine, and that was about it.
Okay.
So
When
I just want to know the way forward because we don't
I
know.
am, I'll show you that.
Yeah,
I'm still gathering information so that I can show you the way forward.
yeah. No problem. Yeah.
Um. Okay. So, how long ago was the tracheostomy done?
Um, it was done April.
In April. Okay. How long ago did she come off the ventilator?
Yeah, April, May, probably. She came off the ventilator in May.
In May. Okay. Okay. So, um, and what about, is she incontinent? Does she use a catheter? How do you manage continence?
Um, yeah, she used the catheter and those things.
Catheter.
We have a nurse
Okay.
changing that regularly,
Okay.
and yeah,
Okay. All right. And basically, they send you home without any guidance, nothing.
nothing. So
Wow. Wow.
yeah, it's a lot of trainee doctors and they more in Trinidad here they're more focused on critical patients to the point that once they could revive the patient and dies a day, the families had to organize from there.
Very much
So
so. Very much
yeah.
so.
So once you live in, yeah, they may really have
Yeah. Yeah. Okay. All right.
much input, yeah.
Yeah. Okay. Um, does your mum cough? Does she have a good cough?
Yes. That is
Okay.
what's going on right now, and it make her real uncomfortable.
Yeah. Yeah. Okay. Do you use nebulizers?
No, no.
Okay. All right. Okay. Do you know what I mean with a nebulizer?
Yeah, the kind of cleanse the air or to help the breathing, or yeah.
Yeah. It's more about making sure that the air that she's breathing is moist.
Mm-hmm.
Because if she's only inhaling dry air, that puts the tracheostomy at risk of blockage.
Oh,
You are okay. So let's just, you asked me what's the way forward here.
yeah.
So one of the problems here is, if the tracheostomy blocks, you don't have a spare tracheostomy, and the risk of the tracheostomy blocking is real.
Mm-hmm.
So the first thing that I would advise you is to get spare tracheostomies. That is the very first thing I advise you to get,
Okay.
right? Because let's just run through a worst case scenario here. Let's just say the tracheostomy blocks. She can't breathe. You need to change the tracheostomy,
Yeah.
right? And you don't have a spare one.
No.
So here's what you need to do. You need to find out what size tracheostomy she has.
All right.
Okay,
It
let's just say for simplicity, she has a size 7 tracheostomy.
right.
Okay, you need another size 7 tracheostomy,
All right.
but you also need a size 6 tracheostomy, and here is why. Let's just say the tracheostomy comes out or blocks and you need to change it, right? And you can't get the size 7 back in, you need a size smaller to establish that airway.
Okay.
Am I making sense?
Yeah. Expect. Yeah.
Okay,
Exactly.
so that is the very first thing you need to do. You need to buy the same size tracheostomy and the size smaller.
And one smaller, yeah.
Okay.
Mm-hmm.
Now, there's a very high chance your mother has a Portex tracheostomy or a Shiley tracheostomy. There's a very high chance for that.
Mm-hmm.
And you should be looking on their websites, you know, where to get them.
Okay, so we could order this off Amazon or straight off the website?
You should be able to order them online. So it's often a Shiley.
Shiny, how spell that?
I'll type it in.
All right.
I'll type it into the chat pad. Hang on. They're the most common brand. There's other brands as well, don't get me wrong, but they're the most common brands. So I've just typed it into the chat pad. So that's number one. Number two, are you checking her oxygen levels regularly? Oh.
Yeah, sir.
There we go.
Yeah.
That's okay. That's okay. Right, Ryan, are you checking her oxygen levels regularly with an oxygen monitor?
Yeah. Yeah.
Okay. And what does that look like?
Oxygen levels, let's say approximately 90 to 93.
Okay. Does she have any underlying lung condition?
Other than the clots, no. She was on vaccine and those things for the clots and whatnot, and she yeah, that is basically it in terms of any other underlying thing is the clots. Nothing else
Okay.
with the lungs. Nothing.
But what I'm asking, Ryan, is does she have an underlying lung condition, respiratory?
No.
Okay. Because 90 to 93, it's not very high. It's too low. Do you have oxygen at home?
No.
Okay. All right. It's not. It's too low, and I would strongly recommend that you get a nebulizer, a saline nebulizer. You can buy a nebulizer machine. You can buy a nebulizer machine at the pharmacy, probably at your local pharmacy,
Yeah,
or
I
online.
have one at home. I have one at home. Yeah.
Okay, I would start using it as soon as possible. How does your mum breathe? Do you have a humidifier?
No, I just have the air condition and that's it.
So the tracheostomy is open to air. You haven't got a filter.
Nothing.
So
Just open.
can you have a look at this? So the tracheostomy is open like this, like I'm showing you here.
Just so, yeah, exactly. Yeah.
Okay. There needs to be a filter.
All right.
Right? And here is why. There needs to be a filter because an open tracheostomy is an infection risk. Massive infection risk. Okay. So you need to attach what's called an HME filter.
H&B.
I'll type this here.
Yeah.
HME filter.
Mm-hmm.
Okay. But you need to get a humidifier as a matter of urgency. You might have seen the humidifier in hospital.
The humidifier. Yeah.
You need the same at home. So here is the risk, Ryan.
Yeah.
Without an HME filter or without the humidifier, the air will dry up.
Okay.
Right? Air will dry up and the tracheostomy will block eventually. That could cause a death for your mother. Your mom could die from that.
Wow.
Ryan, what you really need here is I will help you in the short term. What you need here, you need someone at home that can look after her 24 hours a day, that knows what to do with the tracheostomy. Your mom's life is hanging at a thread.
Mm-hmm.
But I will help you in the meantime what to do to begin with until you have, what you need to do in the short term. Now, other question. Do you have a resuscitation bag?
No.
Do you know what I mean by that?
Not totally, no.
Okay, I'll show you one. Just give me another second. I'll show you one. Just give me a second.
Sure.
So that I can show you what I'm talking about. Because again, this is critical. This is potentially critical for your mom's survival, right?
Okay.
Just give me a second. So this is, I'm not sure whether you can see that here. This is what a resuscitation bag looks like. And you might have seen it in hospital. Can you see that?
Yeah, I see that.
Have you seen something like that in hospital?
I'm not familiar with it, no.
Okay. So basically, can you see that end here? Hang on, where is it? That end here, that will attach to the tracheostomy.
Okay.
And then you can inflate air into the tracheostomy in case of an emergency.
Okay.
Right?
Mm-hmm.
So really they've dumped your mom at home without any help whatsoever.
Exactly. Yeah.
So here's another thing. So I talked about the cuff, and I'll show you that again. Hang on, I'll show you that again. Just give me a second. I'll just need to bring up the tracheostomy again. Just give me a second. So, can you see that cuff here? The balloon?
Yeah.
You need to check that twice a day. You don't want it to be overinflated, but you also don't want it to be underinflated. But what you need for that is you need a cuff manometer. I'll type that in, right? Because what happens is this. If it's overinflated, your mom might end up with pressure sores in her throat. If it's underinflated, your mom is at risk of aspiration and saliva going into her lungs, ending up with an aspiration pneumonia.
Mm-hmm.
Are you following?
Yeah, I am.
Okay, all right. So then let's just run with the worst case scenario, because you really need to understand what you're dealing with. Let's just run with the worst case scenario. Let's just say the tracheostomy comes out and you can't put it back in. Okay.
Yeah.
You need to have a face mask.
Mm-hmm.
Right? So you can use this ampu bag here and inflate air through a face mask in case she can't breathe.
Okay. Or the face mask that going on the nose. Yeah.
Okay. So then let's just quickly talk about the nasogastric tube.
Yeah.
Okay. So how often do you give feeds?
Every 3 hours.
And how much do you give?
Approximately 60, around 200 ml.
200 ml. That's feeds or water?
That is liquid food feeds.
Are you there?
Yeah, feeds.
Feeds. And then you flush it with water?
Yeah.
Okay. How long has the nasogastric tube been in? How long has it been in for?
We recently changed it. A doctor came and changed it every month.
Every month. Okay. Okay. How do you know when you start feeds that the tube hasn't migrated into the lungs? How do you know?
But we usually check with the air, with the empty.
Okay.
Yeah.
So
On the
you
stomach.
check. You've got a bladder. You've got a syringe,
Yeah. Yeah.
and you're using a stethoscope.
No, I use my hands.
Okay. That's very risky. That's very risky because the risk, as much as I'm all for nasogastric tubes, the risk with the nasogastric tubes is they migrate, and they might migrate upwards, and then all of a sudden you've got feeds going into the lungs, and that could also cause her to die.
Mm-hmm.
Right? So, so you are having some super high risks here, right? Super high risks. Now, we had, I'm not sure how much research you've done. We are providing intensive care at home here in Australia. And if patients in a situation like that don't have 24-hour nursing care with critical care nurses, people have died. You're sitting on a ticking time bomb here.
Mm-hmm.
Other question. Are you the only person providing the care, or do you have other family members that help you?
Yeah, approximately two additional, yeah.
Right, but still, you are more or less, your family is looking after your mom 24 hours a day.
Yeah.
Yeah. Now you are sitting, unfortunately, you are sitting on a ticking time bomb here.
Yeah.
I'm not trying to be negative.
Mm-hmm.
I'm just realistic, and from what I've seen, if you were here in Australia, we could provide 24-hour nursing care, and it would be government funded.
Right. Not here. Not in Trinidad yet. Yeah.
I hear you. And I fully understand why you're doing it. It's your mom, and you don't want to leave her hanging. But I also need you to be extremely cognizant of the risks that you are taking.
I am. Yeah. Well,
How far away are you from the hospital?
probably let me say about 10 minutes.
10 minutes. Okay. And have you needed to get her back to hospital since she's been home?
No.
Okay, you're very lucky. Very lucky. Do you have, when you check her oxygen, do you have her connected to the oxygen monitor all the time?
No.
How often do you check it?
Usually every time we finish our feed, every 3 hours.
Okay. Every
Yeah.
3 hours. Okay. And it's always around 90 to 93.
Sometimes it might go up to 98, but most times you're looking at 90 to 93.
Okay. Okay.
Because the brainstem damage that happened from the diagnosis those doctors gave us is basically she could breathe on her own, but just not consistently.
She can breathe on. Yeah. I can see that. It's not, with oxygen saturations 90 to 93, she's also at risk of oxygen starvation for the brain. Right? And if she's at risk of oxygen starvation from the brain, that puts her at even higher risk of more brain damage.
Okay, so that's considered low. 93.
Can you say again, please?
I said 93 was considered low.
93, yeah, I would consider it low. 90 is definitely low. Is your mom, that's what I've asked, is your mom, was she a smoker, or was there anything like that?
No, she was just a bipolar case. Basically,
Yeah.
it was real. It was terrible.
Right. Okay. But not. Yeah. Okay. Okay. That's fine.
But
So.
nothing out of the ordinary like those things.
Right.
No
Right.
smoker, no drug abuse, anything like that.
Yeah. Okay. Okay. So this is what I would highly. So in an ideal world, okay, let's just say we would be providing 24-hour nursing care for your mom, which you absolutely need to keep your mom safe. First off, we would only send you nurses that are tracheostomy competent, that can manage that airway 24 hours a day. You absolutely need this equipment that I mentioned to you. The other thing that I'm typing in here, you need ideally a Fisher and Paykel humidifier,
Okay.
right? I'll type this in. One of their models is the MR850. I'll just type this in here. You absolutely need that, right? You need spare tracheostomies. You need the AmpuBag that I've shown you. You also need, ideally, a tracheostomy dilator. So let me ask you this. Do you know if the tracheostomy was a surgical tracheostomy or a percutaneous tracheostomy? Do you know what I mean by that?
Surgical, I believe it was surgical.
Okay. So that means if it was surgical, it means it must be a stable stoma.
Yeah.
Must be a stable stoma. Okay, that's good. That's good. But you are still at risk. Okay, again, let's picture the worst case scenario again, Ryan. It's 3 o'clock in the morning, the tracheostomy blocks, and your mom can't breathe. She could die in minutes. Okay, let's take another scenario. Again, it's 3 o'clock in the morning, the tracheostomy comes out, and you can't get it back in, or you don't have a spare tracheostomy. Your mom could die within minutes.
My question is as I tell you, I'm not too familiar with the tracheostomy, right? With the track. So the track could come out on its own?
Very much so. What if can your mom move her hands?
Yeah.
What if she pulls it out? What if she pulls it out? Or what if you turn your mom, I'm sure you turn your mom on your side every now and then.
Yeah.
So what if you turn her on the side and it catches, it got caught somewhere, you pull it back, you don't see it, and the tracheostomy comes out. Just because it hasn't happened, doesn't mean it's not going to happen. And it is absolutely life-threatening if it does happen.
Okay. Yeah, well, as I tell you, this is I asking you all these questions because I don't know anybody personally who have a track. So
You can see,
yeah.
you knew something's not right. You knew you need help.
Yeah. Yes.
But you can see, I'm not here to be negative. I'm just trying to manage the risk.
Yeah, well, I will try to work on getting some of these instruments you mentioned here.
Yeah. And I can certainly, we could provide training to you online how to change a tracheostomy in an emergency situation. We can certainly do that.
Yeah, sure.
What you might do is, it's probably best if you reach out to me.
Okay.
Offline. Just reach out to me and I'll just text you. I'll just send you my email address here. Hang on. Just email me here or call me. Are you on WhatsApp?
I am.
Call me on WhatsApp. I'll text you my WhatsApp number here. So here's how you can contact me. Oh, hang on. Can you see that?
Yeah, I am. Yeah.
Just contact me there. All right. Well, if you would like to try, I can see there's someone else commenting they would like to see the training. Just contact me if you would like to have some training. Just contact me. Well, there's someone saying welcome to where I would like to see the training. You've got my contact details here. Just contact me. I will need to be clear. We will charge a fee for the training.
For the training. Okay.
But we can talk about that offline. How much time would be involved. But your mom's life is hanging at a thread, and you need to be very cognizant of that.
Yeah. All right. So we can't get into those items. What I want to really find out as well. So, is it possible that she could talk? Because right now she cannot talk, and you can see she trying to talk.
She can't talk as long as the cuff is up. As long as the tracheostomy cuff here, as long as that's up, she won't be able to talk. It's blocking the vocal cords. It's paralyzing the vocal cords.
So there's no possibility of her talking.
Not with a cuff tracheostomy, unless you can take the cuff down. Unless you can take the cuff down, or she can use an uncuffed tracheostomy. There's no way she can talk.
Uncuffed. What is the difference between the uncuffed and the cuffed? What is the advantages?
Yeah. The difference is you're using a cuffed tracheostomy if someone can't swallow. That's when you're using a cuffed tracheostomy, right? Because it prevents a patient from aspirating. And you're using an uncuffed tracheostomy, generally speaking, when someone can swallow but can't clear their airway and they need suctioning. That's the difference.
So in this case, they would have noticed that my mom cannot swallow.
Most likely. What would help if you wanted some training? What would help is if we could also look at the medical records. We probably would need to do both, because then we can guide you. I need more. I've told you about the nuts and bolts today, but in order to guide you, can she talk? What does she need going forward? We would need to look at the medical records, if that makes sense. It goes beyond this conversation today.
Okay. Yeah. I would have to get
Need to get access to the medical records.
I can't get access to it. It's just you have to put in the request to get it. Yeah.
Sure. Your mom's life is hanging at a thread, Ryan.
Okay.
All right, Ryan. I need to let you go because I've got to wrap this up.
No problem. Right. So I will message you on the WhatsApp, and
please.
Once it is within reach, I will try to do it. Yeah. Okay. Thanks so much. Yeah.
It's a pleasure. All the best. Thank you. All right. Well, that was a really good session with Ryan there. Now I've got to wrap this up now. If you want help for intensive care at home like Ryan does here, go to intensivecareathome.com, contact us on one of the numbers on the top of our website, or send us an email to info@intensivecareathome.com. We are currently providing intensive care at home all around Australia with critical care nurses into the home. It's NDIS funded, TAC funded, NIISQ funded, DVA and iCare funded. So reach out to us there. We also provide level 2 and level 3 NDIS support coordination. With Intensive Care Hotline, we provide consulting and advocacy for families in intensive care all around the world. You can get more information at intensivecarehotline.com. Call us on one of the numbers on the top of our website, or send us an email to support@intensivecarehotline.com. And I do one-on-one consulting and advocacy as well over the phone, Skype, Zoom, WhatsApp. We also have a membership for families of critically ill patients in intensive care, and you can get access at intensivecarehotline.com if you click on the membership link, or you go to intensivecaresupport.org directly. We also do medical record reviews in real time for families in intensive care so that you can get a second opinion in real time. We also offer medical record reviews after intensive care. if you have unanswered questions, if you need closure, or if you are suspecting medical negligence. I also talk to doctors and nurses directly on your behalf. I also represent you in family meetings with intensive care teams. Also, subscribe to my YouTube channel if you like the work that we're doing. Subscribe to my YouTube channel for regular updates and for the YouTube lives. Click the like button, click the notification bell, comment below what you want to see next. Share the video with your friends and families. And I do the weekly YouTube live every week around the same time. Thank you so much for watching. Don't forget to smash the like button and subscribe to my YouTube channel. Take care for now.